Hand hygiene, video 6. So, we're going to continue in the administrative controls part of the hierarchy of controls. We did review administration controls in the last two videos. So, these are changing the way people work, saying this is the order in which we want you to do things. So, we're going to talk about hand hygiene. Hand hygiene is the most common mode of pathogen transmission. That means having germs on your hands, either in, a work sense or in a regular sense, is a common way. Hand hygiene is the most important part of standard precautions. We talked about the blood-borne pathogen standard. Standard precautions is part of that, and hand hygiene is its own specific recommendation. So we need to do hand hygiene whenever our hands are visibly dirty, when we've touched a contaminated object, before and after each procedure. This is where it really starts to pile up at the beginning and end of each day, and also out of after any handling or removal of your gloves or your personal protective equipment. Alcohol-based hand rubs are another hand hygiene we're very familiar with, but in a death care or healthcare setting, we're looking at a content that's 70% or above. They found that these can be less drying than soap and water, 30 times a day, and they are easy to keep in accessible places. Like you might not have a sink in the middle of the room, but you can put alcohol-based hand rub in a convenient place in a room. So this is an old study, but it really shows how bad we are at hand washing. The areas most often missed are the ones that tend to be where we touch things the most. So our thumbs, particularly the outside back of our thumbs, our fingertips, including our nail beds where our fingernails are, and between the fingers are where we are most often to miss. And if you kind of did your own hand washing technique by yourself while you're watching this video, I bet you would feel that you tend to grab and go outside your pinkies. So these are the World Health Organization's primary recommendations for hand washing. Most hand washing will be very similar to this. But, if you're in a place where you can do so, put your hands out front and kind of do a little demonstration. First thing we're going to do is get the soap or the alcohol-based hand rub, and then we're going to rub palm to palm. Then you're going to cross your fingers by putting your hand on the back of your hand and doing in between your fingers, and then put your hand on the other back of your hand, do it in between the fingers. Then you're going to go crisscrossing your fingers in front of you. Then you're going to take your nail beds and you're going to hook your hands together and then squish your fingernails around in the palm of your hand. Then you're going to specifically wash all the way down your thumb from the back onto the nail on each hand. Then you're going to take your tips of your fingertips and rub it right on the palm of your hand where the wrinkles are on each side. That should take about 20 to 30 seconds, and that is how you're going to get all of those areas. We also need to think of our skin, especially on our hands, as a barrier from pathogens and disease. It is one of the best barriers we have because it's so good at blocking things out. But having to wash our hands so much during the day can actually damage them, and that becomes an occupational risk in it of itself, is getting dermatitis or hand rashes or cracking from washing and from using alcohol-based hand rubs. So there's a few things we can do. We can try to use cool or just barely warm water. Hot water is actually bad for our skin, which is maybe not, I was taught to wash with extra hot water, but nope, it's bad for your skin. Also, how we dry our hands, if we're using paper towels or regular hand towels, just to pat gently, not rub them really, really hard, is more gentle on our skin. Our skin also being a barrier means that if there's a cut or a burn, we need to protect it with a bandage or some other covering because that can be open to getting pathogens and disease into our cut, including bloodborne pathogens. Latex allergy. Latex is a type of material that we made gloves and other tools, disposable tools out of for many years, but it can cause allergic reactions for some people. So this could be like a skin dermatitis reaction, or this could be an actual like anaphylactic reaction. So many clinics are moved to latex-free clinics. You don't see latex gloves as much as you did in the past, but you should know if you're working with latex because you can develop a hypersensitivity. Other considerations. If you're working with bloodborne pathogens, you should not have long artificial nails or nail decor like gems and rough things that are added to it. You should not have chipped nail polish or long, jagged fingernails with rough edges. All of this can harbor bacteria. So it's actually a risk to yourself to have these on. Another thing that affects how the gloves work is pieces of jewelry. Large rings, they tend to be kind of sharp. They can rip gloves, they can harbor bacteria, and I've heard of people losing their ring taking gloves on and off. Also, lotion can affect the integrity of gloves, especially highly perfumed lotion. So if you love extra nails like this is probably going to be a problem when you're trying to put your gloves on and off. Same thing if you have, that giant engagement ring. You don't want it to harm the integrity of your gloves. Let's move into disinfection. And this is how we keep surfaces clean. Disinfection is the destruction of pathogenic bacteria, viruses, and other kinds of microorganisms by physical or chemical means. It's not complete sterilization. We need to clean the surface, wipe it up before we apply disinfectant. So it's two separate stages. We want to remove all of the debris and physical contamination. So this might be blood or tissue or spilled chemical. Many recommendations I saw said use antimicrobial soap and water, but depending on, your work practices, you might have something different. And then after you clean it, you're going to disinfect it. You're going to look for an Environmental Protection Agency, EPA, registered disinfection. It may be a chlorine bleach solution, but they become less effective over time. So you want to make sure that you read and follow the directions, that you're mixing it and only using it for the amount of time that's recommended. So you might have a Clorox for healthcare that you're using regularly, or Cavicide is another common hospital grade disinfectant. But let's look at the packaging in these photos. The hazard pictograms are most likely on the backside of these products in the directions that you would want to read, but there's this number on the front of either of them. So there's this little 3 flying over from the Cavicide, flying over from the Clorox. That's what's called the kill time, and it's a big part of how the disinfectants work. So let's look at the chain of disinfection. You're going to start out with finding that EPA registered product in number 1. Then you are going to read the directions, including the hazard communication and how it's supposed to be used. Then you're going to pre-clean that surface. You're going to use the soap and water to wipe anything down, get off any debris. Then you're going to apply the disinfectant for the kill time. So I think when we're cleaning at home, we are basically just wiping and applying the disinfectant in one fell swoop, but generally you want to wipe it and then go back and cover it or spray it with the product. You're going to leave it on for the 3 minutes like we saw on those product directions. You're going to wear your personal protective equipment while you're doing this. Then after you remove your PPE, you're going to wash your hands for that 20 to 30 seconds because they may have been contaminated during the cleaning and disinfection process. I did see some literature about using ultraviolet light to clean surfaces, but I think this is really only applicable in hospital settings and is not generally adapted in the death care industry. Sterilization. Sterilization is different than disinfection. Sterilization is about killing all forms of microbial life. Why do we sterilize? To prevent cross contamination between tissues between deceased? But one of the main reasons is to protect workers. Hepatitis B can live in dried blood for a week or more. So we have to remember that bloodborne pathogens continue to be a risk factor after people are deceased. Critical instruments. These are instruments that actually are going into the tissue, blood, and other bodily fluids. So that might be your scalpels, your hooks, your scissors, your trocar. Then you might have single-use items. So these are disposable items. These are not to be reused ever. Reading the manufacturer's instructions, you'll see a 2 with a no slash through it. We should not reuse single-use devices. You're going to dispose of them properly. Transport. We don't want to be walking around the clinic or the workplace with sharp, dirty instruments in our hands. That's how accidents happen. So you want to have the instruments on a tray, a tray on a cart, transfer them into a container with a lid to carry to the disinfection sterilization area. Pre-cleaning and pre-soaking can help the dried blood and debris from really hardening onto the instruments. So you can have a liquid in the tray that you put the instruments directly in after working with them. Or if you're not going to be able to work on the instruments for a portion of time, you could put them in a pre-soaking bath to make sure that blood and debris doesn't dry on the instruments. So much like disinfecting surfaces, for instruments, we need to clean them before we disinfect or sterilize. So if you're going to be doing hand cleaning, you're going to want to wear a puncture-proof glove. So we might have a utility glove like what we talked about in PPE or a much higher grade nitrile glove, but you want something that will prevent you from accidentally poking yourself. This is a very high risk to get a sharps injury, so when you're cleaning dirty instruments. If you're brushing them, you want to use a long-handled brush and brush away from yourself in controlled movements. And you would be wearing your personal protective equipment during this process, like your gown, your mask, and your eye protection. There are some automatic cleaning methods, like this is a countertop ultrasonic cleaner that uses sound waves and movement to help clean the instruments. So sterilization methods. There are multiple sterilization methods. There's dry heat, cold sterile, and then moist heat. And moist heat can consist of boiling instruments for a recommended amount of time or using hot steam under pressure, which is called an autoclave. The most common sterilization that I saw was cold sterilization, which means you're leaving in the instruments in a chemical bath for a certain period of time. This chemical needs to be mixed correctly, it needs to be monitored that it's working, and it needs to be changed exactly when the manufacturer's instructions or the directions say it needs to be changed. So Wavicide is just a product that's out there, and you would want to read the hazard communication label and then follow the instructions exactly to make sure that it was doing what it was supposed to do. Then after you disinfect the instruments, you're going to rinse them. You're going to make sure that they're completely dry, and then you're going to put them in some sort of locked, organized storage. So you know the difference between where are the dirty instruments, where are the clean instruments, and have them well maintained so you're not at risk of using a dirty instrument when you thought it was clean. So you've made it through some more administration controls of hand hygiene and disinfection and sterilization. You did great. I'll talk to you in video 7.